Can the coronavirus affect your heart? What's up, people? Welcome back to Chatterdocs. I'm Dr. Tor and I'm an internal medicine physician. In this channel, we're gonna discuss everything and anything in medicine and health in our own way. So if you're new here, don't forget to hit the subscribe button and turn on the notifications so you won't miss anything. Today, once again, I have the great cardiologist, Dr. Fima Macheret with me. We're gonna discuss the effects of the coronavirus on heart. Dr. Macheret has done his medical school at the Mayo Clinic, his internal medicine residency at Cornell, New York. He worked as a hospitalist in the University of Pennsylvania and UC San Diego, and he is now in the second year fellowship of cardiology at the University of Washington in Seattle. So without further ado, let's dive in. Hey Fima, how you doing?
Hi Sam, I'm good. How are you?
The same, thanks for asking. Once again, I'm very happy to have you here. Tell me, what's going on up in Seattle?
It's a gorgeous fall weekend. We have beautiful blue, clear skies and fall leaves and colors everywhere. We went to the pumpkin patch yesterday, a socially distanced pumpkin patch, of course. We're enjoying fall before our true rainy season starts here.
So, as you know, we're gonna talk about COVID and heart. So, tell us, does COVID affect heart as well?
Yeah, I think that's a great question. And I think I'd like to start with just saying, first, what is heart disease? It's a broad term that can mean everything from an acute myocardial injury to chronic ischemic disease to chronic heart failure or arrhythmias. Heart disease refers to anything really that disrupts the heart's function, including diseases of the heart muscle, the lining of the heart, the rhythm of the heart, blood flow to the arteries that supply the heart, and the heart valves. Whereas heart failure refers to a chronic state of insufficient cardiac output or forward flow to the heart associated with congestion or a backing up of fluid. So the way that COVID is linked to myocardial damage is that COVID enters all cells via the S-spike protein that it has on its surface, sort of in those pictures with all of its little red projections. It binds onto what's called the ACE2 receptor. And heart cells do have ACE2 receptors, although these ACE2 receptors tend to be more prevalent in other tissue, especially the peripheral vasculature, which may be one reason why thrombosis or clot formation is such a particularly prevalent problem in this illness. In terms of assessing whether somebody has myocardial injury or heart injury from COVID, we would do most typically an echocardiogram, and then after that move to other imaging modalities like cardiac MRI, which can show us new inflammation, it can show us old fibrosis, and then we would move on to laboratory tests like troponin and natriuretic peptides, which indicate myocardial injury and myocardial stretch respectively. And then, after unfortunately, many patients obviously die of the disease, so it's also possible to assess cardiac damage afterwards in a post-mortem study. One interesting study recently did try to demonstrate myocardial damage using cardiac MRI. It was in JAMA Cardiology, Puntman et al. In July 2020, showed a cohort of German patients who had recently recovered from COVID-19 infection. Cardiac MRI, which as I mentioned is very sensitive for detecting inflammation, showed 78% of their patients had ongoing myocardial inflammation. So we really don't know what the overall long-term implications of that are going to be. We have many patients who have what's called a dilated cardiomyopathy or heart failure, and it's often due to old viruses. That's one of the most common causes of that. So we don't know if we're going to see a rash of dilated cardiomyopathy cases in the future, many months or even years down the road. Previously, the most common viruses that caused that were called Coxsackie virus, and right now the most common is Parvo B19 or the slap cheek disease, since you have a young child at home where may or may not be exposed to at some point.
Fortunately, not yet.
Not yet. The daycare is a little tenuous right now. That 78% seems higher than our internal numbers, for example, here at UW. But we've had patients with myocardial injury, as I mentioned, based on blood tests and other things. But it certainly wasn't 78%. But obviously, different subtypes of the virus do exist in different regions of the world, and that may be one explanation for why we see a different rate of direct effect in different studies.
So based on that study, they have found that there is inflammation in 78% of those COVID patients in their heart. but we're not sure if those inflammations are gonna be something reversible or are gonna be something turning into like a bad heart disease or heart failure or something.
It's going to take a little bit of time to actually figure that out and do kind of case control or other types of studies or cohort studies of people exposed to COVID and to see what are their rates of cardiomyopathy down the road.
You mentioned these ACE receptors, and a question that comes up very frequently is that because so many people, so many patients with high blood pressure are on ACE inhibitor medication like lisinopril, captopril, and benazepril, all the pril medication. And this question comes up that what is the implication of this ACE2 inhibitor, these ACE2 receptors that are involved in COVID pathways and taking these medications?
The current recommendations, according to the American Heart Association and ACC, American College of Cardiology, their consensus statement is they recommend continuing ACE inhibitors and treating per usual methods. There's no evidence that being on an ACE inhibitor increases your COVID severity. And specifically about ACE inhibitors, I can say that people benefit from them, especially those with heart failure. They reduce mortality by a large amount in patients with heart failure. They improve people's cardiac function.
One other very frequent question is that do people with existing heart disease like heart attacks or heart failure, do they get more severe COVID?
In general, those with cardiovascular disease are more prone to severe forms of COVID illness, holding everything else in balance, assuming the same exposure, the same amount of exposure. But patients with coronary disease and hypertension, they're not necessarily more prone to a more severe course out of the whole total of cardiovascular disease patients, meaning heart failure patients, unless the COVID directly causes a thrombotic or a respiratory complication that affects their coronary artery disease or their hypertension, whether it's because they weren't able to take a medicine that they should take, or it causes them to have a worsening of one of those diseases.
So per se, the previous heart disease is not making you prone to more severe COVID, but if it's something decompensated that decreases your heart or lung reserve, then it puts you at more severe complications, not only from COVID, but from any other infectious disease, right?
That's exactly right. If you're not on oxygen, but the COVID causes you to be, you're on oxygen, or you're on heart failure medications, you have severe COVID, you're in the ICU, you can't be on those medications, and that's not good for your heart failure either. So there's a lot of ways.
All right, so in which other ways has COVID caused higher mortality and morbidity in association with cardiovascular disease?
So I like dividing this a little bit into the direct and the indirect ways that COVID has influenced morbidity and mortality. First of all, it's directly led to myocardial injury, as we mentioned, in the form of myocarditis or inflammation of the heart muscle, arrhythmias, heart failure, and myocardial infarction. In addition, cardiovascular toxicity of some medications, such as azithromycin and hydroxychloroquine, are because of their potent QT prolonging ability, is worth mentioning. Furthermore, many severely ill patients will require corticosteroids like dexamethasone, which also increases people's blood sugar, blood pressure, and affects cardiovascular disease risk as a result. Some people may need to be on it for an extended course. It leads directly to myocardial injury via non-myocardial illnesses like stroke, pulmonary embolism, or blood clot, and other medical illnesses as well. Leading to, COVID leads to potentially excessive procedures where, for example, some patients who get COVID and get a blood clot can have changes on their EKG that can be mistaken for or look very much like an acute heart attack. And so then they end up having to get cardiovascular procedures in order to rule out that heart attack, which are not without risk either, or may even delay treatment for their underlying conditions. And then you get the angiogram and it shows no occlusion, and so you maybe have delayed treatment of their blood clot or whatever else is causing that. So in terms of indirect causes, we have, people are delaying their care for non-COVID and even COVID-related cardiovascular conditions. And when time matters, that has a huge difference, like in myocardial infarction. Of course, we all say time is muscle, but when patients are delayed up to days from their heart attack, they can develop the severe mechanical complications of heart attacks, like acute mitral regurgitation or rupture of their free wall or of their septum, which carry extremely high mortality. And so we've actually seen a number of cases of that. Many people hadn't seen those in years because people would come in immediately for their chest pain.
Have you had like one yourself, like any case like this?
Yeah, we had a case of what's called a ventricular septal defect, where somebody's septum and their septum between their left and their right ventricles was so injured from a heart attack that it developed a hole, and it wasn't able to be patched or anything like that, and the patient died. And had they come in 4 days prior, perhaps that wouldn't have happened. Perhaps with restoring blood flow within a short period of time, as is the goal, would have prevented that.
Well, I hope that we get out of this situation, not only for the cardiovascular reasons, but also for so many other disasters that this demon has been causing. Why don't you tell us some take-home points or wrap up this whole meeting?
The big takeaway point for people listening to this, especially if they have cardiovascular disease, is to make sure that they stay close with their cardiovascular physician, make sure that they're taking their medications, make sure that they're following up with them, and really doing everything they can to not contribute to either being a case or potentially to other cases. Really socially distancing, washing your hands frequently, and wearing a mask in public, and limiting going out to only when is needed. All of those things are altogether going to help us, and we're going to limit cardiovascular risk that way. And hopefully, as you said, we will get through this sooner rather than later.
Thank you guys so much for watching this. Once again, if you like this video, don't forget to hit the like button and share this with your friends, and also make sure you subscribe to the channel and turn on the notifications. For more videos to come, stay tuned.